Hello everyone. Today in my video, I'm going to talk about blood pressure and hypertension. So now coming to what is blood pressure? So blood pressure is the force that the circulating blood exerts on the walls of blood vessels. Suppose think like this is a blood vessel. So whatever blood is flowing, so the force that the blood is exerting on the walls of the blood vessels is called as blood pressure. Now I'll give you an easy way to remember. Suppose think there is a water pipe. If it is empty, it is when the water will flow, right? Suppose imagine I block this side of the pipe and I connect this side to a tap. What will happen? The pipe will bulge in size, right? So for the water to flow, what do you need? You need it to be normal without any blockage. So blood pressure in our body is the force that the circulating blood exerts on the wall of blood vessels. So like you see, when the blood pressure is high, it is called as hypertension, when it is higher than the normal limits. So this is a blood vessel in case of a high BP, and this is normal. So what is happening here? So basically, there is vasorestriction, that is like there is hardening of the blood vessel. So the flow of blood is not normal. Whereas when the wall is normal, you can see lot of blood flow. Now coming to how is the heart and blood pressure related? So basically we are concerned of how the circulating blood is exerting on the walls of blood vessels. So how is the blood circulating in aorta or anything? Like now let's come to heart. So whenever the heart contracts, like imagine your hand contracting. So whenever the heart contracts, the blood rushes into aorta. Okay, that is all the blood will rush and go out. Okay, so imagine this is your heart, easy way, and this is aorta. Whenever this is contracting, the whole blood is going like this. Okay, so this is called, what is happening here? When the heart is contracting, the whole blood is going through aorta. It is called as systole. And when the heart is relaxed, it's not contracting, it's relaxing, then it is called as diastole. Let me repeat again. When the heart contracts, the blood rushes out of aorta. And when heart relaxes, the blood goes into ventricles. So when the heart contracts, it is called systole, and when it relaxes, it is called diastole. Okay, so everyone must be aware of what this is. This is a BP machine, an electronic one. So the first reading which you see is systolic pressure, and the lower reading which you see is diastolic pressure. So I told you what is systole and diastole, and what is happening in aorta, that is when the heart is contracting, the blood is flowing through aorta. So there is a pressure in the aorta. That pressure is systolic pressure, and when the heart relaxes, the ventricles are filled with the blood. So that lower pressure is called as diastolic pressure. So this is systolic pressure and this is diastolic pressure. Let me again explain. So think this is heart. Okay, when this is contracting, the blood flows out, ejection happens, that is through aorta. Okay. And when it is relaxed, it is filled with blood in ventricles. So this is systolic pressure, this is diastolic pressure. So these are the two readings which you see. And I would like to tell you something. Throughout the day, there will be fluctuations in your blood pressure reading. If you try to take it at night, it will be low as compared to when you take it in the morning. It is because in the morning, you do a lot of physical activities. You work for like 8 hours and then do some exercise, or if there is any sort of stress, the levels are high. But at night, when you are in a relaxing mode, the levels go down and the fluctuations in BP is quite normal. So at night it is lower, and it also fluctuates with emotional stress a lot. Now coming to what are the guidelines of hypertension. So normal is when your systolic is 90 to 129, 60 to 79. Stage 1, stage 2 and critical. Stage 1 is when systolic is 130 to 139 and diastolic pressure is 80 to 89. Stage 2 when it is 140 to 179 and 90 to 109. So basically, like if you are in stage 1, it looks like this is what they mean, 130 by 80. And critical is anything above 180 and diastolic about 110. Now coming to what are types of blood pressure. Primary hypertension and secondary hypertension. So basically it's types of hypertension. So what happens is the primary hypertension is a dangerous one which constitute 90% of the hypertension. So primary hypertension can occur due to old age, due to obesity, due to high salt diet, and due to lack of exercise, smoking, and drinking. And no exercise is also a very important cause of BP, hypertension. And secondary hypertension is because of some underlying diseases, like it can be kidney disease or any endocrine disorders. Okay, so there are two types of hypertension. Primary hypertension occurs due to old age, obesity, lack of exercise, and high salt intake, smoking, and drinking. Whereas secondary hypertension occurs due to kidney disease or endocrine disease. So there is an underlying cause in secondary hypertension. Mostly what happens is with age, the blood vessels usually get hardened, and also with unhealthy diet, it gets hardened. Suppose it should look like this. What happens is it becomes like this. What I would like you guys to imagine is if you take a pipe and fill lot of dirt inside it, what happens over the time? There is no proper flow, and slowly what happens is if there is lot of hardening here, because of the pressure, there will be leakage, which will silently affect our body in many ways. It can cause a stroke in heart and brain. It can cause loss of eyesight. It can cause kidney damage. So that is the reason why hypertension is called silent killer, because you never know once you're a hypertensive patient, when it is affecting all parts of your body. So now coming to what are the causes and what is the treatment of hypertension. So basically, like I told you, what is vascular resistance? Suppose this is your blood vessel. It is normal. But in vascular resistance, what happens is there is hardening due to age or like other factors. So the flow is not normal. Okay. And when your heart works more than what is necessary, like there is cardiac output is too much, then it is called increase in cardiac output. Now, what is cardiac output? So per minute, how much volume of blood does heart pump? Per minute, how much volume of blood the heart is pumping is called as cardiac output. So when the cardiac output is more, the heart is functioning more than how much it is needed, That is also a cause of hypertension. It will lead to hypertension and vascular resistance also. So the treatment, the medication part would be something to reverse these two causes. So there will be something that will dilate the resistance, that is called vasodilators, and there will be medications given to decrease the cardiac output. Now coming to treatment. For any lifetime diseases, like I have described in my previous videos, lifestyle changes is very important. And in a hypertensive patient, it is highly recommended to cut down on the salt and manage your stress and do a lot of physical activity. The medication for hypertensive patients is mainly like it is targeted on two things. One is to improve the, to decrease the vascular resistance as well as to decrease the cardiac output. Also, what happens is, if a person is having lot of sodium in their body and lot of water in their body, there is retention of these both. This is what happens in kidney patients. So those patients are given diuretics so that the excess sodium and water is taken out from our body. So let me tell you some normal symptoms when you can suspect a hypertension is, the person, if it's an elderly patient, the symptoms would be headache. The main symptom is headache and lot of sweating. And if it is a kidney patient, you can notice there is swelling in your legs. It is happening because of water retention and sodium retention. And if there is any itching on your legs. So these are the symptoms which you should look for. So I hope you guys have understood what is hypertension and what is causing it and how to treat it. Please like, share, and comment and subscribe on the bell icon for notifications. Thank you.